Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today are Dr. Paul Jannetto, Director of the Metals Laboratory at Mayo Clinic, and Sarah Erdahl, Technical Specialist Coordinator in the Metals Laboratory. They are here to discuss the unique opportunity they had to complete testing on locks of hair from the composer Ludwig von Beethoven. The results from these lab tests were recently published in the Clinical Chemistry Journal and shared by news outlets all over the world. So thank you, Dr. Jannetto and Sarah, for joining us here today.
Thank you.
Happy to be here.
For our listeners who have not yet heard this fascinating story, can you tell us how Mayo Clinic came to be involved in this project and what historians were hoping to learn?
Sure. It all started when Dr. Neda Rafai, who's a biochemist at Boston Children's Hospital and Harvard Medical School, contacted me back in April of 2023, asking if the metals laboratory here at the Mayo Clinic did heavy metal testing on hair. He knew we had a top-notch metals laboratory, and he was working with Dr. William Meredith, who is a Beethoven scholar and a board member of the American Beethoven Society, along with Kevin Brown, who was actually an owner of 2 authenticated locks of Beethoven's hair.
Wow.
Now, throughout Beethoven's life, his health issues had been well documented, and he had been seen by over 11 doctors. We know he suffered from abdominal and digestive problems since he was 25 years old. His hearing problems and deafness began around 1801. He had liver disease, cirrhosis, pneumonia, along with several abdominal happenings, and he ultimately died March 26 in 1827 at the age of 56. An autopsy performed by Dr. Wagner the next day listed cirrhosis of the liver and massive abdominal dropsy. Well, back in 2007, an article was published by Writer that claims Beethoven's health problems, specifically his loss of hearing and demise, was due to lead toxicity based on the presence of high concentrations of lead in hair that was tested. However, last year in 2023, a genomic study demonstrated that the Hiller lock, which was formerly known as the Guebara lock that was used in Writer's study, actually belonged to a woman, not Beethoven. And now the genomic studies did authenticate 5 of the different 8 independent locks of hair they tested. It did show that Beethoven had several genetic risk factors for liver disease, as well as evidence of an infection with hepatitis B, and that may have all contributed to his death. However, it never really shed light on the definitive cause of his deafness and his gastrointestinal problems. So as a result, we still really didn't know if Beethoven had been exposed to high concentrations of lead, which could have caused some of those symptoms. And that's why Kevin Brown, who owned 2 of those 5 authenticated locks of hair, wanted to have them tested in our heavy metals laboratory to see if they contained any metals.
Wow, what a fascinating opportunity. Well, before we give away the answer, let's go to Sarah. Sarah, you were the one who ran the testing on Beethoven's hair in our metals lab. Can you walk us through the process of preparing, handling, and testing the samples?
Sure. So like Dr. Jannetto said, we received the 2 locks. We received them in urine collection containers, but within bags within these collection containers. And so I was wearing gloves the entire time. And I took a portion of each lock. And what we do in the lab, we obviously hair is a solid sample, and to run on our piece of equipment, the inductively coupled plasma mass spectrometer, they have to be a liquid. So what we have to do then is digest the hair sample. So after first we clean the hair, we take it through a vacuum filter, we wash it with a detergent, and we wash it with water and filter out all of that liquid. Next, we put it in an oven to dry for a few hours, and then at that point we do the digestion steps. We add some acid, and we add acid to break it down into that liquid form, and then it's ready to go on our mass spec at that point.
Very interesting. So a complicated process and something that our laboratory does very well. Thanks for that explanation. So let's get to the answer. Dr. Jannetto, what did the test results reveal about Beethoven's health?
So our findings confirm the presence of high concentrations of lead in the 2 locks of hair. So it's about approximately 258 micrograms of lead per gram of hair in the Berman lock, which was collected sometime between late 1820 and his death in March of 1827, and approximately 380 micrograms of lead per gram of hair in the Helm-Thayer lock, which was collected
Wow.
in April of 1826. Now, these concentrations are approximately 64 to 95-fold higher than our current lead hair reference interval, which is less than 4 micrograms of lead per gram of hair, respectively. And so these high concentrations of lead in his hair shows that Beethoven was exposed to lead, and those lead levels could be associated with those gastrointestinal ailments and his obviously decreased hearing and hearing loss. Now, some possible sources of how he got exposed to lead could be the plump wine. We do know that Beethoven drank wine, and back in the day, it was common practice to add lead acetate to wine to bind to the acids of vinegar in it to sweeten it and turn it into a sweeter tasting wine. Could also have been for many of medical treatments. Lead acetate was added to bandages as a disinfectant. But in the end, we believe that this is a very important piece of a complex puzzle that historians, physicians, scientists have been trying to better understand the medical history of this great composer.
Wow, fascinating. And he was only 56 when he died. Well, this brings us to the fact that we were able to conduct this really fascinating analysis. Mayo Clinic is just one of the few institutions that has a metals laboratory. Can you talk about the other types of specialized testing that occurs in this lab?
Yeah, the metals laboratory at Mayo Clinic is like few other labs in the world. A very highly specialized laboratory that we operate in an ISO 7 class clean room for ultra trace metal analysis. We operate 6 days a week, 2 shifts a day, and we have a top-notch, highly experienced staff with 5 laboratory assistants, 22 technologists, 8 specialists, 3 development technologists, supervisor, assistant supervisor, and 2 directors. We offer a very comprehensive test menu, from heavy metals, like we tested with Beethoven's hair sample, to trace elements like chromium, selenium, copper, and zinc. And for these essential trace elements, we're often concerned more about deficiency in patients, while for the non-essential trace elements, it's more concerned about toxicity in being exposed to them. As Sarah mentioned, our lab uses inductively coupled plasma mass spectrometry, which is considered the gold standard methodology for both sensitivity and specificity for elemental analysis. Our lab also supports numerous clinical areas within our practice, from emergency medicine and toxicology with heavy metal poisonings, to radiology and nuclear medicine, where we measure gadolinium from gadolinium-based contrast agents, or we perform qualitative assurance testing for zinc and iron in gallium-68 dotatate, which is a clinical PET radiopharmaceutical that we manufacture here at Mayo Clinic for the localization of somatostatin receptor-positive neuroendocrine tumors. We also do blood and synovial fluid testing for orthopedics. So for people who have hip and knee replacements, since over time the metal particles around some implants, the metal and metal implants, can cause damage to your bone or tissue, and this can cause adverse local tissue reactions. The FDA actually recommends monitoring blood, chromium, cobalt concentrations in symptomatic patients with these metal and metal hip implants. We also support numerous research studies. For example, in pediatrics, we're helping clinicians look at metal dyshomeostasis and how levels of zinc, copper, and selenium may be implicated as a potential causative factor for autism spectrum disorder. In the end, the metals laboratory, our test menu is basically the periodic table. We measure the elements in various matrices, from blood, serum, synovial fluid, hair, nails, all the way to tissues. A unique thing that we also do is we also perform kidney stone analysis by FTIR to identify the constituents of kidney stones that have been either passed or surgically collected, so that we can identify the constituents and prevent the formation of future stones.
Well, thank you, Dr. Jannetto. Yes, you and I have worked on a kidney stone project in the very far distant past as of today. So, well, it's really impressive what you and Sarah and the rest of your lab have been able to accomplish. And thank you for sharing this fascinating story with us. Thanks again for joining us today.
Thank you.
Thank you.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.